Thanks, Karen. So yeah, we come to our last session of the week. It's been a fantastic week of loads of different programs that are specifically targeted at people with Parkinson's. And I'm delighted to introduce Cliona McCarthy, who I know through doing LSVT Loud with Cliona. Also, Cliona facilitated me getting a videofluoroscopy, which is a scan of my swallow. And subsequent to that, I've been doing expiratory muscle strength training to strengthen my swallow muscles as well. Excuse me, it should be given out to me that I didn't take enough water before I started. So I've been working with Cliona probably on and off the past couple of years, and she's a fantastic therapist. She's a speech and language therapist working with the HSC in Dublin South City as part of the Adult Primary Care Speech and Language Therapy Service. Her interests are working with clients with acquired communication, voice and swallowing disorders, and the Lee Silverman Voice Therapy program, of which she's a certified clinician. So it's really brilliant having a HSC practitioner here, because it's something that, you know, we need to get view of, and hopefully Cliona will let us all know how we can access her service or other services within the community for speech and language therapy, and what's out there and available to us. But I think you're going to enjoy today's session, and you're going to learn about your voice like you never learned before. So without further ado, I'm going to hand over to Cliona. Thanks very much, Cliona, for taking time out of your busy schedule with clients to come with us today.
Hello, hi everyone. My name is Cliona, and thank you very much, Rochelle and Kieran, for the introduction, and thank you for letting me speak today. I'm a speech and language therapist. I'm working in Dublin South City within the HSC as part of the Primary Care Adult Speech and Language Therapy Service. And I suppose I was asked to speak to you today about a program called the Lee Silverman Voice Treatment, so LSVT, as we call it for short, and it's a treatment program designed to help the speech of people with Parkinson's disease. So I suppose what I wanted to do today, for yourselves, for some of you it may be a program you've heard about before, others might be completely new. So what I just would like to do today is, first I just have a presentation just giving a brief background on, I suppose, speech difficulties for people with Parkinson's, what they look like or what people are reporting, and then tying that into LSVT and that treatment program and how it helps the particular difficulties that people have. And then we'll get a chance, I suppose, as part of this week has been an exercise taster week for yourselves, we'll get a chance to actually practice the exercises with myself. Okay, so just to start, I suppose, as an introduction, I suppose communication, I suppose that's my area that I'm working with, people that have issues with communication. So communication through speech and language is a complex process coordinated through the brain that requires precise timing, nerve and muscle control. So exactly, it's a complicated process, and if there's any issues there with the muscle control or your timing, your coordination, I suppose your speech can be affected. So then I suppose just going on to speech problems and Parkinson's, I suppose many people with Parkinson's can have problems speaking when they first developed the condition. And I suppose almost all patients, like 89% with Parkinson's, will experience with problems with their speech and voice at some stage. So obviously that's a very high number. And I suppose it is a range as well. You know, some people might only have mild difficulties, or maybe some might have more severe, but I suppose it's a high number that's affecting, at least they may experience some problems at some stage with your speech or voice. So important to be aware of it, I suppose, and knowing, I suppose, the treatment options out there if you do notice any change in your speech. So I suppose, what are the problems with speech and Parkinson's disease? So I suppose the main thing, these are the main symptoms, I suppose, that people are reporting. So one is a soft voice, so a low volume. So I would have a good amount of people coming into me just saying my voice has gotten a lot weaker, or sometimes they don't even notice it. It might be their family member says, yeah, I just don't hear them as much anymore. So that kind of soft voice, low volume can happen. Slurring, so I suppose because it can affect the muscles and maybe the timing and the movement of them, your speech mightn't be as clear. lack of variation and expression. So in Parkinson's, I suppose, disease, people can have this lack of variation and expression. So they almost come across a bit monotone, which if we think about that for our speech, is, we use sarcasm and we use intonation to get messages across, to get jokes across to people. So it can be really important, it's part of our speech. And if that's affected, it can also affect your communication, I suppose, how you're communicating with others. Another one can be hoarse or tremulous voice, so a shaky voice. Hesitancy or difficulty in getting the word started or getting it out. Repeating of, I suppose, syllables, words or phrases. So repeating that first sound in a word or saying the same word again. So these are just some examples of some of the problems with speech in Parkinson's disease. So I suppose then, why do these problems occur? So I suppose these speech difficulties in Parkinson's, they occur to that lack of coordination or reduced movement in the muscles of the voice box, so your larynx, your throat, which is your pharynx, the roof of mouth, soft palate, tongue, lips, and lungs. And if you think about it, when you speak, there's a lot of different processes there. You're taking a breath and you're using your lungs. It's coming up here to your voice. You've got muscles here. Your vocal cords are moving, and then it comes up to your mouth and you're moving your tongue and your lips to make different sounds. So if there's any issues there, I suppose that with that lack of coordination, reduced movement, that's why people can have difficulty, I suppose, with their speech. So then this is just a little bit of, I suppose, of a process of maybe what happens with Parkinson's with that low volume. So just going down to the bottom there about, I suppose, reduced motor output. So because of, I suppose, how the muscles are affected, you can have that reduced motor output, which then produces soft voice. And then I suppose another part that happens, I suppose, with people with Parkinson's is they may not recognize that their voice is soft. So that monitoring piece of being able to say whether I'm loud enough to be understood can be affected. So sometimes people might come into me and they themselves, the person with Parkinson's, might not notice that change. But if you talk to a family member, they've noticed that change in their voice, maybe going lower. So it's good to maybe check in with your family members as well and ask them, or your friends, and just check in and see if they noticed any changes. And then because of that, I suppose you continue with the soft voice. And that's why I suppose you're not changing it, because I suppose people aren't recognizing that it's gone soft. So that's just, I suppose, a brief kind of overview of maybe the speech difficulties in Parkinson's, which ties us into, I suppose, our exercise class, or the LSVT Loud, I suppose, what we're going to be trying out today. So this is a treatment program, and it was developed in, I suppose, 1984. The University of Colorado speech and language researcher Lorraine Olson-Ramig, she devised the Lee Silverman voice treatment, the first speech treatment tailored to Parkinson's disease. And this treatment, I suppose, was named after, so Lee Silverman was a Parkinson's patient whose family funded the research. So I suppose going into LSVT Loud, what does it look like? So it's a very intensive treatment program of 16 sessions in total. So you do 4 sessions for an hour per week for 4 weeks. So really, really, I suppose, it's for a month, but it's very intense, the program. And I suppose that's the idea, that you're doing hour sessions for 4 days a week with your clinician, doing your daily exercises that we're going to go through, and then you're working through, I suppose, a step-by-step sequence, I suppose, working on your improving that loudness. So I suppose LSVT, it's considered, I suppose, the global gold standard for speech treatment for people with Parkinson's. There's been an extensive amount of research on LSVT Loud, that people with Parkinson's, show improvement in loudness and variation in pitch while speaking, and that they're maintained. There's evidence that coming out that they're maintaining it 2 years after treatment. So that's a really long that they're maintaining those gains. And then most people, once even they've done the program, are doing a maintenance exercises as well after that. So how does it work? I suppose the main focus of the treatment is to speak loud. So if you've ever done LSVT, or if you ever do it, that's the one thing your therapist will be saying to you again and again and again: think loud, speak loudly. That's the main focus and the main cue. And the idea of that is because when prompted with just that one cue, speak loudly or think loud, people with Parkinson's, they automatically take in a deeper breath, they open their mouth more for better resonance and articulation just speaking clearly, and they increase their volume, which makes them easier to understand. So it improves communication by helping you speak with a voice and volume that's easy for others to hear and understand, and it focuses on daily exercises that strengthen the voice box and the speech mechanism. And it also works on that piece about recalibrating your perception, so you know how loud you need to be understood by other people, and getting you comfortable with using your loud voice. And one thing I would mention as well, when we do the exercises, or if you do them as part of a program, we're asking you to speak loud or think loud, but it's always a healthy loudness. We're always looking out for signs. We don't want you straining. We don't want you shouting. We're not teaching you to shout. We're just trying to recalibrate your voice so that you're speaking louder. And that's where, I suppose, if you're working with a therapist, they will help you look out for those signs as well. Okay, so then just, I suppose, an overview of the exercises, and these are some of the ones we get to do today. I suppose there's daily exercises that you're doing every day. So these are the long ahs, right? And we'll go through those as well, where you're holding a long, loud, steady ah. Then you've got the low to high, so you're going to a lower note to a higher note. Then you've got the high to low, so you're going from a higher low to a lower note. And then also you've got your everyday functional phrases. And this is a really nice part about the program. They really focus on trying to make it personalized for the person doing it. So when you're with your therapist, you will come up with maybe 10 or 20 phrases that, 10 or 20 phrases that of sayings that you say every day. So we'd sit down and say, okay, who do you speak to first in the morning? How do you answer the phone? Are you asking, your grandchildren, your kids about school? Whatever is the most important for you. And then the idea is that you're practicing that in the session, but that then when you are actually at home, it helps with that carryover, and that you're actually then, reminds you to use your loud voice, so that you're actually making that change in your everyday, which I suppose that's the most important thing, that you're taking what you're learning from the session, but using it outside of it as well. So those are the daily exercises, and then there's the hierarchy of exercises. So then, as I said, it's a 4-week program, and then, I suppose, and you're working up through this step by step. So you're maybe starting on getting a word and phrases at a loud level, then you're moving to sentences, then you move up to maybe paragraph exercises, and then conversation. So conversation would be the highest as well, trying to maintain your loud voice at this time. And again, I suppose as part of the program, as I said, you can make it really practical. I've had people who they've brought in, a speech for their daughter's wedding that they wanted to work on, or if they were working a presentation, we worked on that. Or for someone else, if they had a children's book that they wanted to practice reading out loud using their voice, that they could read to their children, or they could read to their grandchildren. So you can make it really personalized, is this program, which is great. Okay. So then this is just, I suppose, a bit of an example of, I suppose, a leaflet that I would give to people when they're doing the program as they're a reminder. So again, we'd always say maybe to have a glass of water and sip throughout for the voice. As well, you do your loud ahs, you're doing maybe your low to high pitch glides and scales. As I said, we'll get a chance to do all these now. Then a high to low pitch glide as well, your phrases, and then you might read something out loud, as I said, like a book, or a paragraph on newspaper, an article you're reading on your phone, making as practical as you can. And then, as I said, your goal could be, as I said, for that person, it was, to speak, to be easy to understand at his daughter's wedding. It was to be easy understood when I'm doing a presentation. So you can make it very personalized as well, which is great. Okay, so I suppose that's, a brief tour, of LSVT and the program. So what I would really suggest to you, I suppose, even just from today, that if you would like to be referred to a speech and language therapist and discuss, completing the LSVT program, seeing if it's suitable for you, your speech and language therapist can assess and make sure that it's the right program for you. Or if you have any issues with your communication, I would recommend, linking in with your speech and language therapist. And I suppose within the, I suppose the HSE, you know, getting a referral, I probably would suggest maybe speaking to your GP, because it depends, I suppose, and there's different catchment areas, different catchment areas, and it might be a different health centre that's your local health centre and where your local speech and language therapy team is based. So it may be best to just to speak to your GP about your referral, or maybe another member of the team, such as if you're linked in with a public health nurse or physiotherapist, OT, or dietitian, so they can help you with it as well. And some, if you even go on to, I suppose people here are good with technology as well. If you go on to, I suppose, the HSE, there's a health atlas where if you put in your address, it'll tell you your local health office and give you a number so you can ring. And in some of these places as well, you can do a self-referral, fill out the form yourself. So there's a lot of different options there, and I would really recommend that if you're noticing any changes, to link in with them. And I suppose working on the speech early and LSVT, you know, doing it maybe in the early stages is really, really beneficial. You can do it at different stages as well, depending where, I suppose, the severity of your speech, but it's really good to link in. And if it, you know, if LSVT isn't for you, there'll be other options as well. But I suppose it's just for Parkinson's, it's a very well-known program and has shown to have really good outcomes with people with Parkinson's. If you do the program, you get a chance to, I suppose, you know, work on very particular goals, and as you might do kind of reading tasks, or you might do more conversation as well with your speech therapist. As I said, there's that lovely hierarchy where you're working maybe at words, short phrases, sentences, paragraph, and then conversation, and that's why it's really intensive as well. So thank you very much for today. I hope you enjoyed getting a little bit of a taster of what LSVT is, and I hope I was able to give you an idea of, I suppose, what the program, what's in the program, and what the exercises are like.
Just to say to everyone, I've done the program. I don't know if there's people here who've done it, but you know, it's pretty intense doing the 15, you know, versions, and it's quite competitive against yourself, because you get to see how long you can keep, you know, your ahs for. And the other thing actually is, one of the good things I think about Zoom, Cliona, and probably in terms of having done the program, is to do it in front. You know, the benefit of Zoom is you can see your own expression and your voice and your mouth. So when you're practicing, to do it in front of a mirror, because then you can see whether you're, you know, going out with a small or doing a, you know, a big. So and I think the other thing is, you know, Cliona would say you can never be loud enough. So Cliona, thank you very much again. I really appreciate it.
Very welcome. Thanks very much for having me.
Cheers, guys.
Thank you.